Hi. Okay, so I wanted to talk about a study that just came out on endometriosis. This was done in a mouse model. So basically, what the researchers did was they took a group of mice and they induced endometriosis. They then surgically confirmed that the endometriosis was present and divided the mice into two groups. So the first group was a treatment group, the second group was a placebo group, and the treatment group got therapeutic doses of vitamin C, which is an amazing antioxidant. Love vitamin C, it's so underrated. And anyway, so what they found when they concluded the experiment was that the mice who had received the vitamin C therapy, we saw a reduction in implant volume, so the volume of the endometriosis. We saw a reduction in growth score. We saw a reduction in the extent of adhesions and the severity of adhesions. And we also saw a reduction in follicular atresia. So follicular atresia is like, it's a normal process that describes, the follicles that fail to develop to ovulate and release an egg. And that's totally normal. Most of the follicles that start to develop do not reach the maturity where they are releasing an egg each month. So we do get breakdown and elimination of those follicles, but we want that rate to be normal or optimal. So for example, in premature ovarian failure, we see an increase in follicular atresia. So that's partly what's responsible for that lack or the reduction in ovulation. So we want that rate to be optimal. So in this case, vitamin C reduced follicular atresia, which means there was, in theory, more follicles available to be recruited and then to ovulate. So what the researchers concluded was that vitamin C is potentially a great therapy to reduce endometriosis growth and then to also preserve or optimize fertility. Now, this was a mouse study, so I just always want to say we need to be cautious around the conclusions we draw when we talk about humans or when we're trying to compare those two groups, because might come as a surprise, but human bodies are different from mouse bodies. However, there are lots of great reasons or other types of evidence that we can consider that might make us feel the vitamin C therapy or other antioxidant therapy is a great choice for endometriosis. So, for example, we know women with endometriosis have reduced levels of antioxidants. We know that when we supplement them with antioxidants, we can see reduction in pain levels. We know that oxidative stress is, a big component of endometriosis and impacts symptoms. So it's certainly in my program when I work with women with endo, this is a category or an area of health that we are 100% working on. So yeah, I wanted to share that study with you. If you need some help or would like some help managing your endometriosis and support in more of a naturopathic, holistic lens, then feel free to shoot me a DM. I've got a couple of different programs that can help to support you, and I also work one-on-one with women in Ontario. Okay, thanks for listening, and drop a comment or a question if you have one.